Welcome to the Children's Scrutiny Panel for Kirklees Council. Membership of the panel. I'm Andrew Cooper, I'm Chair of the panel. Other members.
Councillor John Lawson, member of the panel.
Councillor Eric Firth, I'm replacing Councillor Anwar.
Oliver Gibson, Co-op 2.
Councillor Richard Smith.
Thank you. And we have online, we have the Cabinet Member, Councillor Viv Kendrick, and we have the Chair of Review and Scrutiny, Councillor Smage. And we've received apologies from Councillor Paul Moore and Councillor Ephraim Dokrat. Okay. So, minutes of the previous meeting. Any items that people want to raise under that?
Yeah, that's just Lee's. I know she has another appointment.
Oh, Councillor, yeah. Okay, we've got that.
There's two sets of minutes attached. September and December.
Yeah, we've got September and December's meetings attached. Anything anybody wants to raise under those? I'm not seeing any indications. Any declarations of interest? No. Admission of the public. I think everything here can be taken in the public session. Yeah, okay. Any deputations or petitions? No. No public here for public question time. We're racing through this agenda. Right, okay. Main item on the agenda, working together to safeguard children. We've got a presentation over to Kieran.
Thank you, Chair. I'm going to be sharing some slides. If someone could just confirm that they can see them when I pop them up on screen, I'd really appreciate that. I'd just precede it by saying that this is a very large document that's accessible to all. It's 168 pages long. It does go into a lot of detail, so I'm not going to be summarizing the full details today. I will be just giving an oversight. Would welcome prompts and further questions about particular areas of interest, but please do stop me in the flow if you'd like to know more. Okay. So can I just confirm, do people see my slides on screen now rather than my duplicate face?
I can confirm that we can't.
You can't, okay. Let's try that again.
Well done. Is that
a better attempt?
That's an exactly really good attempt. Go for it.
Right. Okay, so we'll make a start as suggested. We're going to of items today, but the first thing to say is that the Working Together document, Working Together to Safeguard Children, was published in December 2023. It was also published alongside a suite of other documents, and as I said in terms of the introduction, there is quite a lot of information there, which I'm not going to cover the full amount in detail. Very lovely to have had it all published just a week before Christmas. So, you know, in terms of opportunities for all partners to have been able to kind of disseminate and understand this, quite a lot to take in at once, but some of the key things will be discussed today. In addition to the Working Together document, what I would say is that we've simultaneously been provided with some new guidance in relation specifically to safeguarding children's partnerships, which is an area that I have oversight of, and the central government's provided us with a small grant of £47,000 to support with that delivery. Okay. Apologies because I'm presenting virtually. I don't see any members or officers on my screen. So if you do have questions, if you could just chip in, that would be great. Okay. Apologies also for the slightly strange animations. So ultimately, these are some of the key things that are coming out of the Working Together document. Now, anyone who works with or volunteers with children should be sharing the same goals, learning with and from each other, and have what they need to help families really key priority that comes through is about acknowledging and appreciating difference and challenging each other when it comes to safeguarding and child protection. I just want to reiterate at this point, and it's something that we've discussed in the informal meeting, this is not just a local authority priority. This document and the guidance is very much aimed at a group of multi-professionals, our partners, not just within health, not just within the police, but across the whole workforce, and that includes our executive and members also. But in terms of principles, what we are referring to in relation to direct working with parents and carers, practitioners should be displaying effective partnerships and the importance of building strong, positive, trusting and cooperative relationships, ensuring respectful, non-blaming, clear and inclusive verbal and non-verbal communication that's adapted to the needs of parents and carers, and empowering parents and carers to participate in decision making by equipping them with information, keeping them updated and directing them to further resources. A key word that I just want to emphasize on that slide there is practitioners. So again, just emphasizing the movement away from some previous reports and directions which refer to social care or council staff members. Okay. Sorry, I just missed out a bullet point at the end there. Similar to the empowering parents point, involving parents and carers in the design and processes of services that affect them. One of the key priorities within working together is about multi-agency safeguarding arrangements. As I described, this is an area of which I have oversight within my role. There are some changes in relation to roles, and without going too much into acronyms, the head of each statutory safeguarding partner, so whether that's from the health, the police or from the local authority, will from now on be referred to as the lead safeguarding partner. So this will be phraseology that will become more commonplace as we go forward. They will in turn appoint a delegated safeguarding partner. Now that may vary depending on the agency. So for some organisations, the LSP, the lead safeguarding partner, may be a chief executive. Generally, the DSP, those that will have the delegated authority, will be those in a position as the director of children's services, for example, or the executive director for their organisation. Okay, they in turn may, depending on how the structures of those organisations functions, delegate further in terms of having a chair for the point of partnership. In our case, as a local authority, that would be shared between myself and Tom in terms of our MASA, our multi-agency safeguarding arrangements. Really critical in terms of the updates for working together is that our education and childcare providers are included in local arrangements, and that's made explicit in the new documentation. So not just the views of education to be articulated at the high levels, but absolutely in terms of the decision making that take place within that. And also absolutely critical, those partnerships include the voluntary, charity and social enterprise sectors, as well as childcare sectors and other third sector organisations. I keep missing the bottom bullet off each page, and my apologies to that. There is, whilst that this is a government and national document, an impetus on the local arrangements to decide how best to implement the independent scrutiny system. We already have, I would say, a really advanced and mature system that's in place, and I myself will be leading on supporting with the review of that going forward in terms of our contractual arrangements with regard to our independent oversight. And similarly, we already have a funding agreement between our statutory leads, and we'll continue to discuss them as we go through our arrangements this year. I think the key part that's come out of working together for a majority of those that have had an opportunity to either read the full document or understand the summary is a change in relation to the element of the Children's Act, which falls under section 17, which promotes the welfare in children and necessitates local authorities and partners to be able to provide what is defined as children in need with support. And what we are working on currently and have been already is ensuring that we are working towards these arrangements in terms of who will be the professional, the lead professional that works under the under section 17. So to speak a little bit outside of jargon of legal talk, What this means is that we will continue to have a lead practitioner, which will always be a social worker. However, those completing the work from a practitioner level may come from a range of different multidisciplinary backgrounds, and we are working very closely together as service directors to work on what that integration and what that implementation might look like from a practitioner point of view. What's really important is that both our early help and social care assessments need to consider the needs of different family members as described in the principles section before, and essentially ensuring that we consider protective characteristics and the other social graces that our children across Kirklees present with. We will be continuing to work very closely with our education and childcare settings to share information, with more of a focus on ensuring that they are kind of core partners in that. And we will be implementing a designated social care officer role to improve those links between social care services and those within the SEND system. Again, I just want to reiterate that in relation to this overall document, we feel that we're already in a really strong footing because we've been working towards this document and implementation well in advance of the publication and anticipation of it. What we do need to have within our new structures is ensuring that we as professionals assess whether children who are at risk or experiencing harm, ensure that we have the appropriate assessments and support in place under Section 17 and 47 of the Children's Act. And so what we're talking about here is ensuring that we don't miss out on those that need to have assessment for additional support, for example, children who may require more formal child protection arrangements. And in line with everything that I've discussed, we will be creating new multi-agency practice standards with those working or volunteering with children who may have experienced significant harm. Just take a quick pause. I don't know if there's any questions at that moment in time. Again, I'm sorry, I can't see everyone. There is also some specific guidance around actions following the death of a care leaver up to the age of 24.
Sorry, Kieran, just to interrupt,
Thank you.
going back to the previous slide, you said there's new guidance around actions there. I mean, is that something that is actually being done by all authorities? Is it something that we have to do ourselves, or is it something that practitioners in lots of local authorities around the country are doing? Just wondering if it's if we're giving ourselves more work than we need to. That's the thinking behind that question.
It's a really good question. I think that because this document has come off the back of a number of previously published documents from independent providers and in turn government response. So there was a review carried out by Josh McAllister almost 2 years ago now that suggested a number of these changes. We've been waiting for the government response to that. A number of local authorities and partnerships across the country have been working up these changes in anticipation. So the quick answer is yes, across the country. Similarly, local authorities and partners will be making changes. Depending on where you are in the country, a number of those changes will already have been taking place to some extent. This is more kind of a progression of a route that we in Kirklees are confident that we've already been taking. So we're not necessarily reinventing the wheel, more just confirming some of the arrangements that we already have and progressing some of the areas that we've been waiting for that central government guidance for. So I hope that answers the question.
It does, thank you.
Okay, so in terms of actions, I hope I get all of the bullet points in one slide here this time. So the KSCP is our Safeguarding Children's Partnership, will publish an updated master document. We've got quite a period of time to do that by December 24. But as I mentioned on the first slide, we also have been given some central money in which we need to allocate before the end of March. So to reassure, we have already been and continue to work on that. And I will be meeting myself directly with our independent scrutineer in the next week, in fact, but also bringing in the broader representation that's suggested by the Working Together document in the coming weeks to ensure that our master arrangements meet the needs of our areas. We will be continuing to understand how best to strengthen the linkage and visibility of those most senior leaders, from chief executives and ICB leads, police to ensure that they have appropriate visibility and confident in their delegation of duties to those under the new arrangements. And we will be publishing an annual report which will summarise some of that in the coming months. I've mentioned the offset of the £47,000. So in terms of reviewing the framework and decision making, this is something that we will do over the course of our existing multi-agency safeguarding arrangements. We met as an executive team on Friday to ensure that we've got these dates in our diary. And crucially, we will embed the children's social care elements by the 20th of December this year. As I've said at the beginning, there's a lot of documentation there, but it's essential that all services, I use that word very broadly, all partners, and really all members and interested parties have an opportunity to review that guidance. There's some really useful summary documents that can help navigate to the areas that may be of individual focus and interest. So whilst retaining the information of all 168 pages may not be a one-place sitting, I would certainly advocate those, have a look at some of the summary documents to see which areas are of interest and to bring back to us. So that's my presentation over. I hope I can stop sharing.
Thanks for that, Kieran. Any questions? Any questions from members? Okay, I've got one or two questions. The independent scrutineer, I'm just wondering who they're likely to be and what their qualifications are, and actually whether it would be appropriate for them to come to a meeting of this panel to give us their assessment of how we're dealing with these new arrangements.
We currently have an incredibly experienced independent scrutineer working with us in Kirklees and have done under an arrangement since 2011. I think I'm sharing my background, so I'll try and stop that now.
Who is it?
Sorry, it's Julie Sykes. Julie Sykes is a former very senior police officer. Julie, I'm sure, would be happy to represent and to come and discuss our reflections on the changes and also how we've acted as a multi-agency safeguarding partnership until this period of time. Julie represents, in terms of chairing a number of panels, as well as having oversight and audit of a number of those arrangements. It's prudent to talk about the fact that we will still be looking at that arrangement and making sure that the arrangement is fit for purpose under the working together documents, and that's a conversation that the senior leads, so under the new arrangements, the DSPs, have delegated to me to have that conversation with Julie going forward to make sure that we continue to meet the needs. I can speak from a personal perspective and say that Julie's kind of scrutineering has been incredibly valued by the partners over the period of the last 2 years.
Joe.
Yeah, just to add to that, there's an annual report that's currently produced by the Safeguarding Partnership. I think prior to Julie sitting in that scrutineer role, we had Sheila Locke. Sheila did come to scrutiny, so I'm sure that would be really valuable to see for scrutiny to see the full expanse of the work that's undertaken. So yeah, I think it's a really good suggestion. So I think, as Kieran has said, this is not brand new guidance, but the changes we've summarised in the report. It's a DFE summary of changes, but we're starting from a really strong baseline because of the quality that's been in place, as Kieran said, since 2011. Thanks.
Marvellous. Councillor Lawson. Oh, you didn't indicate. Okay, thanks for this. I'm just wondering, going forward, we're going to have people from the voluntary and community sector and not from Kirklees who are going to be leading operationally. I think we looked at this at corporate parenting, and one of the things I thought was that actually this could be quite interesting and quite exciting, in terms of what that might mean, in terms of having somebody giving support and help that the council might not be able to do and might be more appropriate. Is there a way of us actually trying to capture the benefits that may come from these arrangements? I mean, obviously there's the report each year, but I'm just wondering if we will specifically bring out the elements of these new arrangements.
Thank you, Chair. I think again it's a very useful suggestion, and a report only says so much. Just to reiterate again that we have a number of regular meetings, not just our overall executive multi-agency safeguarding arrangement partnership meeting, but a number of subgroups that feed into that. I think it would be an absolutely appropriate course or priority for Scrutiny more broadly to review how we're implementing some of the changes in relation to working together as the year goes on. There may be an opportunity for some in-person or direct observation or invites to those meetings, as well as just getting the reports or just getting a feedback at this panel. So maybe that's something that we could discuss, and I'm sure that our independent scrutineer and other partners that contribute to those subgroups and overall group would very much value that opportunity to have that view.
Thanks. Yeah, I mean, I think we could do a lot of learning on the panel with that. I'd be interested to know what it means in practice. That's so.
Yeah.
So thank you. Anything more on this item before we move on to the performance data? Okay. So forward for the performance data. Is it you, Joe, or Kieran, or both? Kieran, kick off.
I'll start off, and first of all, apologies to members and officers present. Vicky's not able to be with us today, so I'll be covering Vicky's data, and then I'll follow on with my own, if that's okay. And it's also quite strange seeing 3 copies of myself at the moment, so I will try to get this presentation on screen as quick as I can. Okay. Typical. Okay, so could you just let me know if you're able to see that, and I'll bring it up in.
Nothing yet. We can see the email that Vicky sent you, but we can't see that. Oh, just a minute. Here we go. No, we're back looking at you again. That's got to be somewhere up the Colne Valley. That backdrop, hasn't it? I mean. Yep, we can see it. We can see it now. Yep.
Some debate over the backdrop. I understand. So I will. Yes, hopefully you can see that as large as possible. I'm not able to actually reduce the slides part on the side, so I'll talk through the slides from Vicky here. So I'm going to be covering the areas of family support and child protection. Please, again, do feel free to stop me as I go through the slides. Be an opportunity to ask some questions at the end. Some of the highlight areas to cover are that we as a children's social care services have seen an increase in the number of open cases from October. However, this is still lower than the previous year, currently at 2,233. Our average caseloads, that's across our social workforce, is 19.1. That's quite variable depending on the role that social workers take, their levels of experience within their roles. So we had a discussion in the Corporate Parenting Board about the concept of our ASYEs, those social workers within assisted years of their work, early days. So just to reassure that those caseloads are well managed with good oversight, depending on the experience of the staff members and also the team managers in that area. So some of the really high strengths to talk about. Our front door is regionally and nationally recognised. Our rates of referrals are significantly lower than England as a whole. The contacts that receive a decision within 1 working day has increased, which is where it is this time last year. That's a real positive for us. And our re-referrals remain stable at about 19%. So the 12-month average being 19.2. Again, that's a positive from our point of view. And if people would like further explanation, please feel free to ask. In terms of our assessment and intervention teams, so to take out some of the kind of social work speak, this is our kind of core social work teams that works with children who may be in need or within child protection plans, or those reaching kind of high levels towards legal matters. Our timeliness of our ICPC, which is our initial child protection review conferences, remains stable. This time last year, the performance was 45%, which has been a huge priority for Vicky, myself, and all of those working in the service area. That's now doubled to 85.1%, and actually the most recent data as well into the 90s. So we're incredibly proud of the work that a number of the workforce have put into doing that. Timeliness of making sure we make the right decisions for our children under child protection is incredibly important. And broader assessment timeliness has improved further to 76%, which is the highest we've seen in the last 3 months and in the last 12 months as well. Despite some of the workforce pressures, visits to children have increased to 82%, and RCPCs, which is the kind of the review element of the initial child protection conferences, have increased to 95%. So hopefully we can see a trajectory here of really improving data, and certainly improved and higher than our statistical neighbours and UK averages. There is some variability month on month in terms of timeliness of core groups. There generally is, because of the small numbers that take place, a reason for that, but we are ensuring that those core group meetings do take place. Our rates of children in need is 225. That is lower than both our statistical neighbours in England, and again demonstrates that children's plans are progressing as our numbers are decreasing, with what I would say is very much enhanced oversight, not just from a senior leadership point of view, but ensuring that the right support is being provided by team managers and service managers across the piece in Vicky's and within the social care elements of my own areas of oversight. Some further strengths to talk about. We've seen an improved timeliness of risk assessments in terms of those accessing our youth engagement service. We do have 17 that remain overdue, but that is because of a result of enhanced oversight. So what we're saying is that where it's appropriate, we'd prefer to make sure that we've got all the right information, all the right people around the table, rather than rushing through risk assessments in relation to those children that are at risk. We're really proud of the fact that our looked after children reviews held on time percentage at 97%. Again, we always want this to be 100% with all of our information. There are some very specific reasons, again, making sure that we get it right for why that's not 100. And the numbers of children that are in care has stabilised. So again, a real combined effort from across children's services to ensure that we've got that early support services doing their work fantastically from Joe's area, as well as some of our specialised services continuing to do so. And in line with practice standards, 90% of visits to children are made in line with practice standards. Just want to focus on two little bits, and this may overlap with some data I'll present within my own directorate. The numbers of children within an IFA, so that is our independent fostering agencies, has reduced from last month. We'll see some slightly contradictory data in my presentation, but I'll explain that as we go along. So we've seen a slight increase from 165 to 168 year on year, but the trajectory shows that within the same period of time, we've actually seen an increase in our internal foster care placements. So that's a real positive. It shows that we're really focusing on our recruitment, investing in both the retention and support of our internal foster carers, and also really asking the question about some foster carers that have been working with us for years about the nature of children that they want to support us working with. So we're really proud of that data. So it's bucked a bit of a trend where we were moving more into paying for slightly more costly and independent fostering arrangements compared to our own internal ones. I mentioned previously that we've got a new head of service that's having oversight of corporate parenting, and in line with our overall plans, we've got 99% of those care leavers who have a pathway plans, 93% of those being up to date, 95% in touch, and 91 in suitable accommodation. Where we see any of those elements between the 91, 93 and 99 and 100%, often that's at the request of the children themselves, children, young people themselves. We must respect their volition within their own care planning. There's always area for improvement. Whilst we're impressed with the timeliness of contacts that I mentioned in the previous ones, we want to look at that further. We have seen a reduction of children on plan for a second time. However, there's been a recent increase to that to 20%. So that's something that we'll be looking at in terms of a deep dive. We do see a high number of Section 47 assessments with a low percentage proceeding to ICPC. So in layman's terms, what we're essentially saying is that we are assessing for additional need more children than then go on to have a status of child protection. So we want to understand that more, because going through that assessment process, this has implications for family, and we want to make sure that we're only assessing those that are in need, whilst ensuring that we continue to have oversight of those where there is a particular need to have that oversight. In terms of those numbers with children on a child protection plan, that has increased to 475. So you'll see from my previous data, we're having a reduction in those on child protection plans, but an increase with those on child protection plans. So whilst that is a bit of a buck in the trend, it does show that we're having appropriate oversight, particularly of an increased number of young people that are presenting with complex needs. But we do want to understand that more. And in relation to that also, we have some out-of-date child in need meetings, and we want to improve that data too. One thing that's really important to us, actually, in relation to that aspect, is about ensuring that our case files are up to date. We get regular assurance from our service managers to show that children on child in need plans and those in child protection plans are being seen in relation to those plans. But actually, the element that we need to improve on is about performance of recording. So that's something that we're having a deep dive with, and it's an element of some of our practice progress meetings. And our child protection review timeliness is currently at 90%. It fluctuates, but it's usually in the mid-90s. So something for us to have oversight for. I've already mentioned the core groups data. Finally, in relation to children in care, we unfortunately, which is part of a national picture, continue to have a small number of children in unregulated settings. To say that our oversight is robust, I would like to say is really kind of an understatement. That level of oversight involves team managers, service managers, heads of service, and myself and Vicky on a weekly basis, and where necessary also includes Tom as our Director of Children's Services. When I say small, currently that number's 5. We have such oversight that we know exactly where we're at. We make sure that we have weekly oversight and meetings with those children in them settings. They are part of care planning meetings, and often they're as a result of the fact that they're the best settings for those children at that time to enable us to support with the likes of reunification back to their biological families. So that's a real focus that we want to have. We are working on creating an embedded approach in undertaking SDQs, which is our strength and difficulties questionnaire for children in care, and more broadly, we discussed that in more detail in recent corporate parenting board. And placement stability for children with an IFA has increased by 3 placements. So just to kind of talk a little bit about what that means is, for some of our children, because of the complexity that we've displayed and because they're not our internal carers, we have seen a slight increase in the movement of children with known placements, which is certainly not something that we want to see. I've seen it personally with some children this week. Sometimes it's out of our hands due to complexities of the placing carers, but it is an area of focus for us. The number of children with an adoption plan is also half that of statistical neighbours. That could be seen as a positive. It could be seen as an area to really unpick in more detail, but we're certainly negotiating with our regional partners in terms of our contribution to adoption support. I've mentioned our YES service. So finally, I just want to kind of summarise in terms of care leavers. This is a real focus, as discussed in care in the corporate parenting board. We are seeking to improve the quality of pathway plans. We have already discussed earlier in the informal part of this meeting, improving the numbers of care leavers that are in opportunities for education and training. What I would say is that aside from the slight data dichotomy on that, there are a number of initiatives, including working with partners about ensuring that we're preparing particularly care leavers for working in the community. And we've had a fantastic recent visit from an independent DFE advisor, Mark Riddle, and we are working through the actions required to ensure that we are making a difference and inroads in some of the suggestions that came through it. So I will stop sharing and open up to members for questions.
Okay, Councillor Lawson.
I did indicate this time, thank you, Chair. So yes, taking us back to caseload management, possibly quite a dry sounding area for the public, but it's also seen by the public as a bit of a ready reckoner about the health of the service quite often. It's and I suppose really it's not just the numbers, but it's also the fluctuation in there, and it'd be
Yeah.
really, I think I'd find it valuable if you could just put a bit more meat on those bones
Yeah.
about how that's being managed and what's been put in place to keep them stable.
Yeah, it's a really timely question, Councillor Lawson. Hot off the press, speaking to our principal social worker, Rob Fordyce, we have had a number of vacancies in what is a competitive market, particularly in relation to social carers, social workers and social work staff in recent years. Unless members are unaware of this, we have still maintained a position of not seeking any agency support, which provides a lot of stability, clarity of workforce within that. And we're really proud of that. Hot off the press is that we have recruited to all of those vacancies as of yesterday. So we are expecting some updates in relation to some of those vacancies being recruited from those from out of the country, as well as supporting with bringing in new social workers as part of our ASYE process that we've discussed previously, and also in relation to those that have come through the frontline and conversion programs. But we're delighted to say that there is a very significant plan of action. That plan of action does not include agency workers. So it's something that we are so proud of the progress that we've made, that we've had a recruitment and a separate retention working group in the last year to make sure that we're able to moderate some of those higher and fluctuating caseload averages. We've been able to step down the recruitment group because we're in such a strong position now, which means that a renewed focus on the retention group going forward to keep those skilled practitioners going forward. So hopefully that provides some reassurance that there'll be some more stability going forward.
Okay.
I was just going to say thank you for that, Kieran. I think that stability is the watchword, and that gives us all confidence going forward, including the staff. Because in the end, they have to be in that environment where they're feeling supported and in a stable working environment. Thank you.
Councillor Firth.
Thank you. Thank you. If you don't mind, if I could come back. Sorry, just slight delay that I didn't mean to talk of any other members. The well-being of our staff is absolutely paramount, and in terms of our retention group, but also in terms of our recruitment group, we are not just seeking to put bums on seats to do that. We want people to be part of Team Kirklees, to feel valued, to see opportunities for development, particularly as we work into a world where there's going to be integration of services, new roles that come up, ensuring that we utilise the skills that come forward. And that's personified by a number of initiatives that we're doing, not just by the formal emotional well-being processes, but some of the initiatives that we've been leading on across myself, Joe, and Vicky's directorates in relation to our time to talk sessions. Thank you, Councillor Kendrick, for also contributing to some of them, where we've had an opportunity to listen directly to staff about the things that matter most to them. And it's often not just about money and compared to the comparisons of the other competitive that's not out there. It's wanting to feel like a team. It's ensuring that they've got effective caseload averages. It's ensuring they've got the right supervision, of which we've had another recent initiative. So all of those things are combined in terms of our policies and what we're driving as an overall children's services at the moment.
Okay. Councillor Firth.
Thank you, Chair, and thank you, Kieran, for that. But I do remember Councillor Kendrick telling us quite some time ago when we had problems with the numbers of social workers that we had a scheme to grow our own, for want of a better phrase, and obviously that's worked. But a couple of questions, Chair. You'll have to forgive my ignorance. Section 47. It's a first appearance, if you like, or first attendance at this meeting. Tell me what Section 47 is, please.
I'd be delighted to. As someone who's a bit of a, I wouldn't say new person, I've been working in local authorities for decades now, but as a clinical psychology, I've had to read up on my social work sections. But just to confirm that within the Children's Act 1989, there are a number of mandated sections that we as a local authority need to be able to provide to the children and populations of Kirklees. Two key ones in relation to the discussions we've had are Section 17 and Section 47. Section 17 is our need legally to be able to provide support, appropriate levels of support to children that are defined as being in need of additional support. Section 47 is where that support requires an assessment to see whether there's even further need that's been able to provide it under what would be called a child protection plan. So whilst there might be some deviation in terms of how that will be implemented going forward under the working together document, there's essentially two tiers to support. The section 47 would be much more where there's been a further indication where there may be either substantiated or information that may indicate children are at more of a heightened risk of harm or need for heightened support. And just to go back to your other point about growing our own, absolutely, that's been completely the part of the recruitment strategy. And within that part of the retention strategy, it's about succession planning as well, making sure that we're retaining and maximising those skills within the new roles that will be developed as part of our integration and further work going forward.
Councillor Firth.
Thank you, Chair. Thank you, Kieran, for that explanation. Thank you very much. There was one slide going back where placement accommodation, it's in 90, I think it was 91% of care leavers were placed in suitable accommodation. What's unsuitable accommodation for the rest?
Yeah, it's a good question, and you know, with every child we care about, every young person we care about, every young person has individual circumstances and situations. I'm not going to minimise to say that there aren't individual children where they may not be in what we would consider to be the most appropriate settings, but that data does include young people that don't want to engage necessarily with us as a service provider, so there will be some percentage related to that. We're working even more closer than ever with our colleagues within housing to ensure that our care leavers are priority in terms of their demands over, or sorry, that's the wrong word, the requirements that we have as corporate parents to ensure they have the correct housing provision. I can't give an answer in terms of housing, but it is a complicated scenario, as I'm sure members will be aware, in terms of capacity. So sometimes that does mean delay to making sure that we get the most opportune housing options for all of our care leavers, which might mean temporary arrangements that are not ideal. But we do know where all of our care leavers live, and we're confident that we have appropriate oversight and that they're in safe environments.
Grand. Okay, so I've just got one thing I'd like to bring up under this, which is care leavers in education, employment and training is persistently low. I think you explained to me earlier on that about 71% of those that could be able to be in those categories are being dealt with. But 99% of those have a pathway plan. So there's 28% where they have got a pathway plan, but somehow or other they're not in employment, education, or training. What's the breakdown of those people in terms of where they are, what they're doing, and how they're being dealt with?
Yeah, again, just to reiterate the point that in relation to the previous question, we do work incredibly closely with all of our young people, and just like any young person or adult, they have their own volition in terms of how engaged they want to be with the plans that we work with them on. So there is an element of, you know, we're not going to be talking about restorative practice, a two organisation that mandates and dictates and pulls the stick out to say, you must do this because this is what's appropriate for us in relation to our statistics. There is an individual basis to each one of those young people that might be meaningful to them at their stage of life. We're talking about a vulnerable group of young people that have often experienced a number of different transitions and trauma, and they're in a stage of life where actually just being able to stabilise their position within society may be the most appropriate and priority element for them. So that will account for some of those areas. However, notwithstanding the fact that within those care plans for the 99%, as you've suggested, there will be very much a volition from both their part and our part to be engaged with formal education and training where we've not been able to succeed on that. And as discussed, it's absolutely a priority, not just for our new head of corporate parenting, but for us collectively as we start to develop our corporate parenting offer, to understand how we can better link, particularly with providers from within industry. I've named Huddersfield Town Foundation as just one example, but actually to learn from the maturity of other corporate parenting boards. I think it's useful to borrow from Pride about how we start to develop some more formal plans for how we can identify those gaps at the earliest opportunity to encourage that. But just to reiterate as well, all of our care leavers do have access to a PA, personal advisor, who can support with that, and we do continue to review them on a child by child, young person by young person basis. So I think what I'm saying is we will never stop, we'll never rest on our laurels until we see every child has the most optimal opportunities. I think we have a collective responsibility to support what that response will look like.
Thank you for that, Kieran. The next question I'd be interested in your views on is the long wait for neurodevelopment pathway support. What action are we taking to try and reduce that wait?
It's a really good question. It's a question that I pose myself on a frequent basis. I hope that's reassuring to hear as someone who, as a director, has oversight of our strategic commissioning. This is not an us and them, a health partners, local authority area. Again, this is a partnership approach and church when we're doing it. And again, this is by no way of dismissing our local issues. That figure is larger nationally and statistically with our local neighbours, but it's still far in excess of an area that we would be comfortable with. We're talking over a year to have that process taken place. I can talk from a professional point of view as a clinical psychologist who has been involved in carrying out such assessments, that, you know, it's an intensive process that requires appropriate skilled clinicians and practitioners to be able to do it. There is a national shortage, not just in relation to the professions that we've discussed in this area before, in relation to educational psychologists, but also in relation to clinical psychologists and psychiatrists, speech and language therapists that are involved in the formal assessments. So notwithstanding that, what are we doing locally and what are we going to do about it locally? We've already taken some significant strides forward on this. And I'm going to use a phrase that I don't use lightly, which is the phrase waiting well. We've worked very closely with colleagues within our ICB and other health partners to identify this priority. Not just least within their leadership forums and their leadership partnerships, of which I attend, but also we're getting it on the agenda of our Starting Well board, of which that I'm a deputy chair of. And one of the initiatives that we've taken place is about ensuring that those that are waiting and initially get on the waiting list have a neurodevelopmental assessment. And to break down what that means is quite often a neurodevelopmental assessment is looking for young people who may go on to have a diagnosis of autism, for example, or ADHD, or other psychiatric diagnoses that may be emerging as children go into adulthood. Is that actually for a large percentage of those young people, we know that once they have that assessment, they will not get those diagnoses. And I know that as a practitioner myself. So what we're looking to do is actually to create a new, we have already implemented a new triage system based on formulation that helps to understand the needs of those young people so that we can divert some of the support needs at the earliest opportunity so that they are, to use my phrase, waiting well. So whilst the waiting lists might be long in terms of that formal assessment, for at least a half of them, by statistics at least, we will be able to have those conversations about diverting for the right level of support, whether that's early support, family support, additional educational support, at an earlier opportunity so that they're waiting well in anticipation of that later kind of assessment. In terms of minimizing that assessment, I would love to claim there was a magic wand and that I have the perfect answer. We continue to try to support with our health colleagues to fill in some of the capacity needs in terms of those priority professions that I've mentioned. But in that absence, what we're really focusing on is going back to the fact that actually a lot of our young people, what they need is the right support at the right time, rather than needing the diagnosis to tell them what support they need at a later date. So I hope that's reassuring to hear, and I would be grateful to provide some further updates in terms of the impact that that has in the coming months, given that it's quite a new initiative.
I certainly would be interested in that. Just to go back to the assessment itself, am I right in thinking, and I could be wrong, that that the assessment is needed to as a key to open educational support, and that's what most people are looking for?
It can be. There are different pathways even within the assessment itself, not to get confused with our educational and healthcare assessments. The neurological pathway traditionally follows more of a route into the more medical model diagnoses such as ADHD and autism. That's not to discount the fact that may fall within an educational and healthcare plan, but it does deviate. And what I would say is that given that some of the diagnoses that may fall from the end of that you can't get until you're an adult, although it may seem frustrating that there's an extended period of time before assessment, quite often they're more indicators about future need rather than something that will result in a diagnosis and immediate treatment, for example, in terms of medication or a change in terms of educational provision.
Okay, thanks for that. Last question from me is about CAMS support. The request for CAMS support seems to be very low. You know, I seem to remember years ago there was an incredibly long wait, and there was a lot of frustration over that. But looking at the figures, there doesn't seem to be many people requesting the service. Any commentary you can give on that?
Yes, in brief, I think this is the positive thing to say about this is, again, the investment that we've had, not just as a local authority, but as partners in relation to our relationship with Northrop Hall, with Locala, with our colleagues in the ICB and SWIFT. We certainly have recognised that ensuring that we get the right support at the right time comes from ensuring that we get the right triage and the right assessment at the right time. We're working, as a number of people in this virtual or real room will understand, on developing our keeping in mind model, which will further develop that process and that triage process further. But what we had identified with some pretty rough and ready figures is that a number of the referrals that may previously have gone directly into CAMS would actually more qualify in terms of the needs of that family and child, in terms of our early support services, or more some of the diversionary services. And I think that what we're seeing to a large extent is an appreciation from the professionals involved about the direct channels in which they need to go to them. All I would want to reassure is that our CAMS colleagues and those pathways exist, and that they are dealing with the children at the different tiers of support appropriately, and continue to invest in those areas.
That's great. Thanks for that commentary. Much appreciated. Councillor Firth.
Thank you, Chair. Again, you'll have to forgive my ignorance, Kieran. You mentioned ADHD and autism. At what stage do children become identified? Do the schools identify there is a need? And are there a lot of children that slip through the net, that suffer from ADHD, and perhaps are identified as having that problem later in the school years when it's perhaps too late?
I think depending on which practitioner or clinician you speak to may give you a slightly different answer to this question, because that can go both ways. There is a narrative nationally from certain professions that there may be an over-identification of young people who may present with the type of behaviours that may fall in line with a diagnosis of ADHD but don't actually meet criteria. And similarly, in respect of autism, because of the nature of autism, it is a spectrum of conditions in terms of those that may be particularly high functioning to those that may be very pronounced in terms of their disabilities or abilities and behaviours. I think that there is a fine line between a necessity to have a diagnosis to get the right opportunities, which is certainly something that you may hear from members within your wards. That you need that kind of that diagnosis or that label to get access to services, against actually, I think, where a national, and I hope to a large degree local narrative, which is about ensuring that instead of necessarily depending on the outcome of an assessment and a diagnosed word, that we are capturing the needs of those young people and matching that to the right support at the right time, irrespective of whether diagnosis comes at one point in time or later on. From my own clinical experience, I've worked with young people that at a certain age may have a diagnosis of ADHD and then may, with years to come, there may be a reassessment of that, and that is no longer the case. And it's the opposite in the other direction. So I think just a word of caution really is that actually the diagnosis in and of itself doesn't necessarily, from my perspective, and certainly a number of other professionals and leaders in the areas, shouldn't necessarily direct where the resource comes. We are at the mercy of a system where that is largely the case, but we can influence it otherwise.
Can I follow that up? Who would make the initial referral? Would it be the school, or would it be a parent that's asking for help?
It could come from a multiple range of professionals or individuals. And whilst we might be discussing our statistics in relation to those that come through our formal local authority and health partner assessment routes, there is also a private assessment route, which a number of parents and young people, and in fact adults, take it upon themselves to go down. I'm going to give some very rough stats here. Typically speaking, those that seek a private route to diagnosis for the likes of ADHD and autism tend to have a higher percentage that come back with that diagnosis than those that come through the more statutory NHS and local authority mandated areas. But that is, there are a number of different directions in. What we wouldn't want to do is to put off any parent, any teacher, any healthcare professional from engaging in the conversation in the first place, making sure that we can triage that as appropriate as possible so that the right assessments take place. And again, if it's waiting well, that the right support takes place in the meantime.
Okay. Anything more on this item? Okay, thank you very much. Next item is pre-decision scrutiny, cabinet decisions on the horizon. I see Councillor Kendrick is online. Is there anything you want to bring to our attention?
Sorry, I got my microphone tipped up. Nothing that's coming to mind today, but I have to just apologise and just say I'm not very well today, so I'm unable to help you.
Okay, Viv, get well soon, yep, thanks for joining us today. Okay, right, next item, feedback from panel members on issues considered by the Corporate Parenting Board. Now my view is that a lot of the items that were considered by the Corporate Parenting Board we've actually covered here today anyway. Is there anything else that was on the Corporate Parenting Board items that we wish to look at? Kieran.
Sorry, just to say, I believe we've, in respect to that item, I know that we've covered some of the items in relation to the Corporate Parenting Board already today, but just to state that the presentation I gave was purely in relation to the data within Vicky's directorate. I do have some additional data to share from the directorate that I have oversight of also. I believe Joe will do too, should panel members wish to hear that.
Okay. Yeah, John.
Just to make a comment on the fact that so much of this agenda seems to have been covered in corporate parenting, and in the past sometimes I've been sat on corporate parenting looking at what Children's Scrutiny have been doing, thinking, well, there's a lot of duplication there, why are we doing that? But of course, at the moment, and especially at the moment, I think slight overlaps are actually to be welcomed. In both scrutiny and on the corporate parenting, and the more views that we can have, the more eyes we can have on certain issues, the better it's going to be. So, and I'm sure everybody in this room would say we would rather have slight overlaps rather than gaps. And I just made that comment. Thank you.
And a comment from me would be sometimes I need to hear it 2 or 3 times before it goes in, if I'm quite honest. Yeah. Know thyself is always a good thing here. Sometimes the message doesn't get through first time. Kieran.
Thank you. I know time is precious for all, and there has been some duplication. Again, it does. The psychologist in me tells me it does help to have things mentioned a number of times for it to stick in, I guess. I know that if Joel, our new head of corporate parenting, was here, he would appreciate the fact that we are discussing these matters more broadly, and we will have a refresh of our strategy, including engagement with members going forward this year. So I think it's appreciated at this moment in time it's an overlap, because we want to really focus on that particularly key priority group of vulnerable children and young people going forward. But I think in the long run, maybe we have a conversation about where there are elements that we have different forum to ensure that there isn't unnecessary duplication. I'm not saying today is that case.
Okay. We'll go to the work programme and agenda plan for...
Sorry.
Oh! Didn't see you there.
That's fine, thank you. A really brief comment that we haven't really touched on. I think Kieran might have just alluded to it, but the comments that were made in relation to councillors all being corporate parents, and we did touch on this at the council meeting as well. And I think that was probably, I think from memory, Kieran, we said that you were going to come and speak to groups, to maybe not yourself personally, but we were going to have a bit of a reinforcement of that at each political group. Obviously, the importance of each of us understanding, because people like ourselves that are involved in the corporate parents and children's scrutiny probably are much closer to this, but it was just to re-emphasise for all members, really, all 69 councillors, how, you know, the role of us over Kirklees, you know, as a corporate parent. So that was just, I wanted to mention that. Thanks.
Okay, Kieran, you got your hand up?
Yeah, thank you for the reminder. I have oversight of Joel Hanna, who is the new head of corporate parenting, and I know that Joel made that commitment, and I know that he would be incredibly keen to have those meetings at the individual groups. Yes, simple answer is yes, we will do it. It will be part of the new strategy. Don't want to override or supersede the purpose of the corporate parenting board and chair of that, but I know that that is a planned piece of work that we would very much appreciate.
Thanks. Councillor Kendrick.
Thank you. Just to say, Joel is in hand with that. He has been given the contact details for the business managers of the groups, and it is shortly, hopefully, going to be making contact to take that forward.
Okay, just a quick comment from me on this. Just as a matter of interest, at the Local Government Association, the new leader of the LGA has asked every board, no matter what policy area they're covering, every policy board, to consider what they might do, to help councils in their corporate parenting roles. So that's something that's actually happening at a national level. And you may look at things like transport policy or environment policy or whatever it happens to be and think, what's that got to do with this? But at the very least, it's being considered at a national level, and members have been asked to think about it, which I think shows that the interest there about the role of corporate parents and our role as councils is there from the very top, which is quite reassuring, I think. Okay, now moving on to the work plan going forward. One item that was due to come up on this agenda, which I've agreed to be delayed, is home to school transport. We were told that they weren't ready to report on it yet, to give us a meaningful report. So I was happy to let them come back to the next meeting with that. That's a particular item we've got going forward. Looking through the work plan, is there anything that anybody wishes to raise or thinks, you know, given the time we are in the council schedule, that ought to be added at some point? Members? Okay. Right. So I think that brings us to the end of our agenda. Thank you for joining us today, and thank you to everybody online. Over to Councillor Firth.
I don't know where your office is, Kieran, but that's a wonderful view.
Well, I would love to say that my office was in the debatable position, because some people say this is not Home Firth, that live in Home Firth. I'm afraid to say that my office is overlooking a residential terrace street in Greater Manchester, so not quite as beautiful.
Okay, and not very windswept at the moment, so that's good. Okay, right. Thank you, everybody. That's the end of the meeting.